Well, he's got emphysema and COPD. He worked in the carpet industry for 30 odd years, so he's got nylon fibres on his lungs.
Following a hospital admission when he was in hospital with pneumonia last year, that I became involved, got a referral, I think it was through the hospital on his discharge, where he was quite poorly throughout the year really.
Last May he was rushed into hospital with pneumonia and his SATs were 63 and his legs alterated and things like that. He was in for a couple of weeks, wasn't he? Yeah.
If he's unwell, he would phone me to say, you know, I'm not very well, or his wife tends to phone me to say he's not very well. Hopefully then I can pop in and see him to do a full assessment.
Every time we have somebody come, we always give them this, or we have to go on an appointment. But anywhere at hospital, or we always take that with us, and I always look at it, and it seems to be a big help.
So the emergency care plan is a shared document between West Midlands Ambulance Service and SSOTP, and it's there to provide guidance for healthcare professionals who visit Mr Webb for them to be able to make a clinical judgment as to how his condition is presenting at that time. So it could be that you know, they're looking at his oxygen saturations or his blood pressure to identify whether he's within the normal parameters that have been laid out within the emergency care plan, and then that gives them that ability to make a judgment of is he able to stay at home, or would he need to be conveyed into hospital. It can also be used for other healthcare professionals like the community intervention team or the GP or out-of-hours doctors, anybody really who doesn't have a good understanding of Roy's parameters really and his individual illness.
The care plan is helping because I know what he's on, his tablets and things.
It's there to reduce the amount of hospital admissions really, to try and relieve the pressure on secondary care, keep patients at home, in their own home, in community where they can receive usually the same treatment that they would be getting if they were in hospital.
The phone numbers are in there, you phone them up, and I've had handles put here and handles put there, and you know, it's this air is all over the house, and no, it's just fantastic. I couldn't ask for any more really.
It's reducing the stress and anxiety of ending up in hospital, going into hospital, having hospital admissions. They're able to stay in their own homes.
I don't think it can be bettered. I can't see what else they can do for me. It covers everything.